Hi, today's episode we're going to be talking about fat augmentation of the breast. Now, the whole world is aware that the breast can be enhanced or augmented by silicone implants. The last 10 years or so, not only silicone implants but even fat grafting to the breast has become a very popular method, and so we get a lot of patient requests, uh, people coming to us asking for what this fat grafting is all about. Now, when it comes to fat grafting, our women, our patients, they have a lot of questions, they have a lot of myths, they have a lot of misunderstandings. And as a plastic surgeon, it's my responsibility that we give you the information, we tell you what is expected out of fat grafting, what is expected out of silicone breast augmentation, and you need to know what this procedure can actually do. Now, being a procedure which is considered for enhancing the breast, it doesn't mean that fat can actually enhance the breast by 2 cups or 3 cups or 4 cups, which is the common myth which our patients have. But this is not true at all. The limitation what we have as plastic surgeons is you can go up to a cup increase, not beyond that, half a cup to 1 cup. So if you have an expectation that you want to look good in dresses by a minimal enhancement and you are scared of silicone implants and you want your own fat to be re-injected back, this is the procedure for you. So we're talking about minimal enhancement. Somebody who wants or who expects half a cup to 1 cup, this is the procedure for you. Now, what happens if you have too much of fat put into your chest? You must understand that these fat structures, they go into the body, they're devoid of any blood supply, and they're actually parasites inside. And if you put the fat like big blobs or lakes, this is not going to survive. So obviously you're going to have a lot of complications in the form of fat necrosis, in the form of fat dying out, in the form of oil cysts, so many other complications which can happen. So we as plastic surgeons, we do not recommend placing these fat molecules or these fat structures like lakes. So we call this fat micrografting. We use very specific instrumentation for this, and when we do this fat grafting, we are actually depositing these fat like small beads, like a string of beads, because these are only 2 to 3 millimeters in size. And when you have these small structures placed inside your breast, the chances that the blood supply to these fat structures to be taken up is very high. So you have a better result, less complications, and you have the result, which is to enhance the cup size by half to 1. So in my practice, what I do for my patients is I try to enhance the cup size by 1, and I use maximum up to 320 cc's per breast. So this is what I go maximum. I even do 200, 250 depending on the requirement by our patients, and I do the fat microdroplet technique where the chance of survival is much higher and the results are more lasting. Now, there could be an issue where our patients want their own fat, but they want higher size. So what do we do such patients? We do it in multiple sittings. So let's say we do 1 sitting now, and after 6 months again we repeat the procedure. As long as the patient can give us fat from the hips or of the abdomen, we repeat the procedure after 6 months and again improve the cup size by another 1, and maybe a 3rd sitting the patients want a higher enhancement. We can repeat it up to 2 to 3 times. There's no harm in that. But the patient's expectations need to be understood that every time fat grafting is done, it can go only by 1 cup. So if you get multiple sittings, yes, you can actually get the result of a silicone implant. I'm not saying that silicone implant is bad. It has its own advantages and disadvantages. Patients who are scared of using silicone, they think something is foreign in the body, that they should not be doing it. This could be a very useful alternative.